All right. Well, welcome to the folks who are in the room. Welcome to the folks who are online. We appreciate you coming to the. I was going to call this I've been calling it a workshop inappropriately for probably why we don't have a lot of people in person, because they're like, I can't handle another workshop for hours and hours. Honestly, this is a 30-minute presentation followed by a Q&A. We'll make it as quick and painless as we possibly can. It's really the questions that you have. We've had obviously a change in leadership here at the district. A change in staff here at the district. So there's all new faces that you're going to see as we go through the policy. There's some changes in the policy as well. I had a chance that, as you and your own organizations review policies over and over and over again, sometimes you miss those things that are blatantly apparent. So through the new staff changes, we've had some fresh eyes come on, as well as the board of directors that are on the actual grants committee has changed as well. So we all look at it from a different perspective. Maybe from your perspective of somebody who's looking at this for the first time saying, I'm not quite sure, or maybe it's in the past, I'm not quite sure what they meant by that. And we're trying to fix those things in the policy so that there's a better flow, and better communication to you on what it is that we're expecting. So if you're online, could you mute your computers? Thank you. All right. So what are we going to do today? We're going to do welcome introductions and an overview of the district. For those of you who already know the Grossmont Healthcare District, it'll be just a rehash of what you already know. For those of you who don't know who we are, what we're all about, we'll provide a little bit of that as well. You get a chance to meet some of the new staff members as well. We'll go over the grants policy and the process. Like I said, it's going to change a little bit different from what you've seen in the past. We're going to have a little bit more structure, I think, in this time around, and accountability. I think if I was going to define the changes from last grant cycles to this cycles, it would be really wrapped around structure and accountability. And it's really for us so we can keep track of it as a district staff, but also so we can best inform the board on the decisions that they're about to make and let them know where their money is going and how successful it is out in the community. Before I get started too far, though, I do want to recognize those folks who are online and those folks who are in the room as our community partners. We know that the only service delivery that we have as a healthcare district is through our library. Everything else we do is through you guys, and we very much appreciate that. And we appreciate the partnership. So as we go through the grants policy and as we go through the grant season, whether you're granted or whether you're not granted, it should be indifferent to the partnership that we have together as a team, because there are times when you may need to reach out to us for support for an individual thing. There are times when we need to reach out to you, and I'll talk about some of those partnerships as we go on through the presentation. So I just appreciate all the support that we've provided each other over the years. Yeah. Yeah, I'm not seeing it. Pardon, while we take care of a slight technical. There we go. Thank you. All right, going back to slide 3. So our history. For those of you who don't know, the Grossmont Healthcare Districts, and really all districts, were generated in 1952 in order to support some of the underserved communities, often rural, but definitely underserved. So in 1952, through the Hill-Burton Act in the US, infused through California and a lot of the other states, we needed to have hospitals in areas that didn't necessarily have hospitals, and to serve those coming back from the war. So a healthcare district was born, a hospital was built in 1955, and that's really how we operated as a community hospital with the public health sentiments as well, in order to care for the East San Diego County community. In 1991, with great foresight of that board of directors, they realized that managed care, as many of you know, got a little bit more expensive. Healthcare in general got more expensive. You can scale better through joining forces, and that's what that group did. Public-private partnership was a very new word in the early 1990s, and leveraging health systems and adding more hospitals to health systems to leverage managed care costs and supply costs, all those kind of things, manpower, really became prevalent. So those board of directors decided to put us out for bid to have an operator of our hospital rather than our own hospital, and Sharp bid on that, and they took operational control of the hospital. We, as the landlord, oversee that they're providing good quality care, that there's great access, that they're financially stable, and that we're doing the best to oversee your interests as community partners. So that's how we've grown to where we are today. Our mission is twofold. One is obviously to make sure that the hospital is operating appropriately. The second part, because Sharp does such a great job at running our hospital, it allows us and the staff to get back out into the community and do as much as we can as a public health agency for East San Diego County. That's really what we consider ourselves. So our geography is 750 square miles. We operate from Campo to Santee and Descanso and down to Lemon Grove. Truly a large geographic area. It's about 500,000 residents that we serve. We were zoned in 2018, 2019, where our elected officials were put into equal zones of about 100,000 constituents each. As a healthcare district, we don't operate that way. All of you are in some way healthcare related, and you know that disease doesn't draw borders. Clearly, we've been through the last 2 years of that. Chronic disease or pandemics or any health related issues are not, they're geographically based, but not necessarily by borders. So our board of directors understands that they're elected into zones, but we operate as a geography, as an East San Diego County geography, and that's the way we make decisions. The way that the grants operates, and I'm not sure for those of you who may not be familiar with this, as you bring in grants to us, we process those grants and package them up and bring them to our grants committee. The grants committee consists of 2 board members, and those 2 board members are the ones who make the final decisions. Regardless of the staff, we do our best to present you in the best possible light. But at the end of the day, it's the board of directors who makes that decision. So as I've walked around and I've grown to meet a lot of you guys as I've been out into the community and had a chance to see your operations, it really helps me because I can put context into what I've seen and those I've talked to. But remember, at the end of the day, it is truly the board of directors who makes these decisions. So that's really how the process works. The second part of our mission, obviously, is why you guys are here today, and that's to be out in the community doing good things for our community. So here's the team, and I know you guys have, it was Barry, my predecessor, had been here for 16 years. Erica, Amy's essential predecessor, has been here for 5 or 6 years. You're probably most familiar with them. We had Sophia here for about a year. But through the transition, and really it was like a lot of people, and me myself, I transitioned out of my previous geography, out of my previous line of work, and got into public health in a community that I have deeply loved for a long time. So through the course of COVID, our staff members have transitioned out into new, sometimes new geographies, sometimes new jobs, and we've brought a great team in. And I'll go over from the top down. Obviously, we work for the community first and foremost. The board works for the community. I work for the board, and from there, my team. We have a chief administrative officer that takes care of all the finances, all the human resources, all the IT, anything internal to the operation is where Tom Scalione is our essentially our the finances are good. You can put your phone on mute if you're online. The folks that you're going to want to know are the folks in orange. So if I can get Amy Abrams to stand up, she is our new Chief Community Health Officer at the district. So welcome to, and 2 weeks old?
Not even, this is day 8, I think.
Day 8.
Bear with me, everyone. I'm really looking forward to working with all of you.
Thank you, Amy, appreciate it. we had a chance to elevate this position up to what I think we always had good focus on the chief financial officer here. Tom Size before that did a great job for many years. But I really thought that this organization needed somebody focused on the external part of the organization. It's the entire reason why we're here. So essentially, Amy is taking care of all of our external operations, from the library to the education to the communication to the programs and services that we want to deliver. Amy's in charge of that. No pressure. It's not a hard job at all. As she quickly looks over to Adi Rojas. Adi takes over for Sophia. For those of you who met Sophia, she's the programs and outreach coordinator. So anything we're out doing in the community, and we've got some great ideas, Adi's going to be out there probably working with a lot of you and partnering on things like the end of summer Palooza that we did last year and the Kids Care Fest and those kind of things. That's what Adi's going to be out there doing. We've got Holland Kissinger. Thank you very much, Adi. We have Holland Kissinger as our new head librarian. We had a director of the library for a long time, for those of you who knew Kathy and those of you who knew Rochelle. We moved the director of library down to a head librarian to keep, Amy's got now a team of 3 people. It's Adi, it's the head librarian with Holland, and it's our soon-to-be communications coordinator who we're hiring for now. And those 3 will do the programming, they'll do the education and communication, and they'll do the library services for all of us. So we're really excited to not only have this structure in place, but we were very diligent over the last 6 months to hire exactly the people that we want to have here working with you guys and representing us. So many thanks to Holland, to Amy, to Adi, and we look forward to introducing you to the new communications coordinator. All right, so last summer, we went through a strategic planning process, and this is what we ultimately decided were the 3 pillars that were going to represent the organization. And the way we did this was it was a cascading effect. For those of you involved in strategic planning, you start with the overall concepts, the large, broad concepts that you want to solve, and then you move those into goals, you move those into objectives, move those into tactics, and ultimately they lead to outcomes, right? And the metrics that you're measuring. And that's exactly how we planned this out. And the board of directors decided that they wanted to work on, and it was a combined event. So our staff, the public health experts, and our board, who knows the community, got together and decided these are the 3 pillars that we really want to focus on over the next 3 to 5 years. This is really in concert with the CHNA, and as we update our strategic plan, the community health needs assessment will guide us. So we'll modify this based on the CHNA that's going to come out this year. In 2025, when the next CHNA comes out, we'll go ahead and adjust our strategic plan based on what the CHNA represents. And I appreciate those who participated in that process with the Hospital Association of San Diego and Imperial Counties. But you're going to see some very broad topics on here underneath the goals. And this is where we're going to fit those tactics that we think we're going to move the bar within the community. Things that we're looking at are mental health, aging, chronic disease, cardiovascular disease, those kind of things. Those are the things that we're going to be focused on. Not unlike what had happened in the past. I don't anticipate that the CHNA is going to change the way what we focus on. There may be nuances of COVID, obviously, over the last 3 years. That's changed a little bit of our everybody's thinking. But what you see through the current grants process and what our primary focus is most likely going to stay the same. But we'll continue to update you as the strategic plan continues to mold itself. Partnerships. So I want to focus on this because this is a key part of who we are and what we want to represent. And like I said, we very much enjoy putting money back out into the community to the people who deliver these services every single day. Very much appreciate the work that you have done for us over the years. But I also want to focus on the partnerships outside of the actual granting of money, on the things that we can do together that aren't essentially financially related, or maybe perhaps we can partner on a financial outcome together. So the top left one is one that I really am pretty proud of over the last year. Cantor BioConnect is a company in CNT that does a lot of biomedical research. What they also have access to is COVID kits. So when our board said, look, nobody at the end of January can get a COVID kit, the federal government, number one, has bought all them out, and they're having a hard time releasing them out into the communities. And even when they do, they're not reaching the part of the community that you all serve and that we want to make sure get these test kits. We got to do something. So the board approved the purchase of 7,550 test kits with about $160,000, and we got them in 7 days. The rest of the community, the rest of the country, all I was getting anywhere else was, yeah, we'll have them in 6 weeks once the federal government has flushed them through. But David Cantor out in Santee got us not only an approved contract, but kits in 7 days. And as I look around, some of you guys may have been the benefactors of those, because we don't necessarily have a venue for distributing those test kits, but you all do. So we worked with Volunteers in Medicine. We worked with San Ysidro. Boy, I'm probably leaving some folks out who are critical. Tribal community we worked through in order to get these test kits out into the communities. Within 14 days, 7 days of purchase, got the pilot here and pushed them out in the community as quickly as we could. And appreciate everybody who was involved in that project. Another opportunity. So the USDA had a grant last year worth about $5 to $10 million that we were interested in. We were all jumping in, but it required a partnership. And so we quickly formed a partnership with the Mountain Empire School District, CAL FIRE, San Ysidro, Supervisor Anderson's office, the Health and Human Services, Office of Health Equity. We started talking about what can we do in the rural community together. And it really brought some interesting perspectives. Those folks who are out in the rural space, the school district issues may be different than San Ysidro's access to care issues, may be different than CAL FIRE's issues. But together we got together and we started talking about common things that we could do together. So the next time a grant comes up, we'll be able to pull the playbook out, lay it down, and be able to start impacting rural community instead of just talking about it. Again, no money's been expended, but thought, the thought processes are already in action. The other one, the HOC, the Health Occupation Center in Santee, we got the community colleges, workforce development of San Diego. We're all working on workforce issues that are coming in the next 8 years. The 23% reduction in workforce in healthcare over the next 8 years they're predicting is significant. I was just talking to the Economic Development Council today. You can see it coming. You know where the iceberg's at. You're the Titanic, and you can just sort of spot it. And in 2029, we don't want to talk about what we should have done back in 2022 to solve the workforce issues. We need to work on that now. So in 2029, when perhaps the rest of the world is scrambling for workforce, we've already created these solutions early on. Sharp in the Heartland Fire District, Chief Swaney, unbelievable guy. He's got his issue was that ambulances were stacking up in the Grossmont Emergency Department. And the next ambulance that stacks up is obviously an ambulance that's not out in the community. But they didn't know who to go to in order to find out how to solve the issue. So we brought together the leadership from Sharp Grossmont Hospital with about 8 fire chiefs. And together we sat down and talked about what issues can we solve together. We know the hospital has a throughput issue at times. But they're trying their hardest to get patients into beds or get them discharged from the ED as quickly as they can. That doesn't help the paramedic who's now an hour and a half wait, trying to offload their patients so they can get back out in the community again. But together we found 3 potential solutions that will help ease everybody up. And at least we all understand each other's problems at the end of the day. So we educate the community on the right access of emergency department care, right? The right access for urgent care and triage. We work with skilled nursing facilities so that there's not a quick call the ED so we can get an ambulance here because that patient was supposed to be at the hospital 2 hours ago. And then when you discharge back to the home again, making sure that there's a bed available to them and they're not stalling up on the floor, holding up a bed. And then Chief Sweeney got a funding through El Cajon City Council to get nurse triage embedded in dispatch. If you think about that, that's such an innovative solution where if you call from El Cajon and they dispatch you, and the dispatch says, well, I know you hurt your foot, but I don't know that that's an emergency department visit. Let's call the nurse triage and see what they recommend. Nurse triage will then flip them to urgent care or primary care based on the patient's need as well and desire, and move that care away from the emergency department to a more appropriate place. And that's the other ones, the Institute of Public Strategies and the Hospital Association through CHNA creating communication about how we can get all of these healthcare issues identified and out to you guys. But I want to show this slide is going to grow and grow and grow. And I want this to be on your mind as well. I know you're here for grants, but once we get done with the grant season, or even as we're going through the grant season, if you think of a way that you can partner with people that you haven't otherwise partnered before and don't know how to reach them or don't know how to get that together, think of us as a convener, a collaborator, a partner, and ways to get that done as well. All right, now for the reason you're all here. Last year, and I'll leave this slide up here for a minute. The ones on the left-hand side were grantees from last year. The ones on the right were sponsorships. Sometimes you can see through the grants policy that you can ask for a grant and a sponsorship at the same time. Many of you know and have done that already. But we wanted to put this up there so you know who in the past had requested grants from us and had been granted grants, to let you know who's in this space. We had about $1.3 million budgeted last year. We spent 1.27. It was about a little over 97% of the money. Proud of that figure. Sometimes there's money left on the table like there was this year. Sometimes we spend it all. It just depends on who's coming to us and what the board has approved. But these are at least last year's award winners. You can see previous years on our website as you go through the public documents. And really, I want to focus on the top as well. So we direct care, hands-on patient care. I think that's important because sometimes we'll have seen grants that don't provide that. It's maybe more of a philosophical or a conceptual type organization that it's not directly impacting the community. And that's really what the committee is looking at. So this year, the dollar figure's gone up. We're going to grant out $2.62 million proposed. The grants policy is going to the board on Friday. If you look at it online, it's going to say draft, and it says draft because we had the board take a look at it. They've reacted to it. We met with the committee this week, provided those changes, and it's going this Friday for a board vote. So the proposed is 2.62 million. 1.371 would go out towards grants. We increased our scholarships this year. Last year was $210,000. This year we're putting out $249,000. And then we reserve $1 million for intergovernmental transfer to support the hospital. This is money that is matched by the state. And so any money that we put in to help the underserved or the uncompensated care, the federal government and state will match that money. And it helps Sharp-Grossmont Hospital take care of those underserved, for the ones that they're not getting compensated for. The added weight, you can see those on there, the aging, the behavioral health, the chronic conditions, those are still things we're going to focus on. Like I said, the community health needs assessment may sprinkle in some additional things based on what's going on in the last 3 years. But in large part, these are probably going to still remain our focus areas. And the applications, anything you received after January 1st requires a 4/5 vote. So really, the July 1st, and many of you know this, July 1st to December 31st is a first come, first served basis. And that's the way we'll process them again this year. All right, so the steps in the process, we'll receive on the last Wednesday of the month is when it'll cut off for the next month. So if we receive the last Wednesday of July, it'll be considered for the August committee meeting. And then on the second week of the month is when the committee meeting will actually meet. And there's a time gap there of about 2 weeks where our staff is getting together and we're putting together an executive summary of each one of your packages. So normally the board members receive anywhere between 10 to 15 pages per grant. And it's a lot to digest, especially in months 1 and 2, when we generally get about 12 to 15 grants. What we want to do is create a cover page up front that introduces them to you all, to the money. It really just takes off the application, those key elements that we want them to know, what we used to call bottom line up front, and they can look at it and get an idea and then start digging into the material, more of the material as they work through. It allows us also to reach back to you if there's something in the process, and I'm sure Barry did this in the past, that as we receive applications, we'll reach back and say, hey, your budget didn't make a lot of sense to me, and I want to be able to explain it, or what you're funding is this, is it really going towards that? And that's going to help us at least represent you the best way that we possibly can as we get into the committee meeting. So, expect, if you didn't hear from us, then we know kind of what is going on, and we're ready to present that to the committee. If not, either Amy or Audie will reach out to you and ask those critical questions, or myself. So in the second week, you're going to go through the grants committee. Anything that's been deferred from the previous month will then get moved. If we do have questions and we can't get them resolved by that committee meeting, you'll be deferred and moved on to the next committee. The third Friday of the month is when the board meets. A lot of you have been online. I've seen throughout the year, previous years. And the third Friday is when we'll make those approvals through that formal board meeting. And then the fourth week of the month, one of us, either me, Amy, or Randy, who I think many of you can become familiar with as well, will notify you that the approval's gone through or what the issues are. And I'm going to keep going if you don't mind, and then if you can take notes, and we'll do the Q&A session. That'd be great. So what are some key really focus areas of things to keep in mind? What the specific goals for each unique client, we look at that. Really, it gives us a great initial summary of what it is that you said you were going to do and what it is that you're doing. And we've had certain cases where maybe you don't often meet the goal, but the write-up becomes critical at that point, because we're not holding you, negligent or any way of not meeting that, as long as you have an explanation of what had happened. And clearly, in the last 2 years, what we've read was COVID prevented me from being able to engage my clients. Get it? Let's move forward and try next year. So I want you to know that, but it does give us an indication of what's going on. No entitlement to funding for fiscal year. This, I think, is in the grants policy every year. We want to let you know that if you don't get funded, or that you're not guaranteed for funding in future years, and that you should take that into account when you're looking at your own revenue streams, that we don't want to make ourselves an operational part of your organization, that it is year to year that this is going to be looked at. And I say that because the committee members change from year to year. So I can't predict who that's going to be. So on January 1st, the chairs change, and the 2 board members who were responsible for the grants and scholarships committee could be 2 completely different in the next year. And they have different priorities, and they have different thoughts and different, so it can be somewhat unpredictable based on who's sitting in the board meeting, what their desires are. The board of directors this is making sure that we serve the East County patients. I've seen there's a lot of organizations out there that are doing great work for all of San Diego County. That is absolutely fantastic. But know that if it doesn't say East San Diego County residents, there's not a lot of chance. I'm going to be right up front. It has to serve our community in East San Diego County, period. And you guys got to be pretty upfront with that. New and innovative programs and services. These are always fun to deal with, and I'll talk about a little bit more about this, but new and innovative services, don't be afraid to try something new. Know that Amy and I are probably going to call you up and say that this is a new thing that you're going to try. Great idea. We need to know a little bit more about the business plan, a little bit more about what we're requesting as far as the official documentation. Let us know your sustainability plan. Let us know what your business plan is. Let us know how you progress in volume over years if you're going to try this new thing. But don't be afraid to put those new and innovative ideas forward. Direct patient care, we already talked about that. And then recipients of grants that are greater than $25,000 in a previous fiscal year will have to go to a 4/5 board vote. So if you ask for, what we tend to see is 30,000 last year, 30,000 year before, 30,000 year before, it's a perpetual. And then all of a sudden you want 40,000 because you're going to add this element to what you were doing beforehand. And that's fine, but it does require a supermajority, called supermajority 4/5 vote in order to get that approved. And just anticipate that when you submit that up. All right, some specific things. So as we went through the grants process, what I saw, just like I said, as fresh eyes coming into this, is I got a little bit of ADHD. I saw a little bit of grants talk, and then it switched to scholarships, and then it switched to grants, and then it went to sponsorships, and I was confused. And so as I went out and talked to some of you folks, I think there was a little bit of confusion on previous grant writing as well, and that we were asserting a lot of good stuff into the policy, but from my own brain, it wasn't flowing for me in a way that communicated to you what exactly it was that we expected. So this gave us all the opportunity to take a step back, to clip out those things that were totally grant related. So you're going to see section 1, grants, and you're not going to see grants again. 1 through whatever the case may be, 15 is just about grants. And the next 4 or 5 things are just about sponsorships. And the next things are just about scholarships. So when you're looking at it from a grants perspective or a grants and sponsorships perspective, know that what you see there is what's exactly in that section, and it's not going to be talked about in any further section. So hopefully it gives you a better flow of information on what our expectations are. Section 6, we changed a little bit of the quality. I talked a little bit about this earlier. The quality reports are so important to us. As I saw quality reports come in, and I'll highlight them on the next slide, some of the things that we saw, it's the only indication that we have that the money we're putting out into the community is doing any good. And some of you are very good about that. Some of you could probably shore it up a little bit, but this information hasn't made its way to the board, to the committee, and I'm gonna get it there. So anything that you write up was generally for in staff to review to make sure it was good to go. I want our board to understand what it is the community, what it is that you guys are doing, the great work that you're doing, and the successes that you're having, so that it's not me being the intermediary for you to be able to communicate that to the board, that they're getting your quality reports directly and they can see what great work you're doing. Keep in mind that when I do that, your documents are going to become public documents, and that they're going to be attached to a committee meeting. So take good care in writing those quarterly reports, because they're going to get some visibility. The grantees will be required to display. Oh, this is one. I think we had a plaque that we had you display, and we got to go back and see if we can get those plaques together. But really, what we're looking for is any sort of recognition, whether it's on your websites, whether it's on your publications, regardless of what the media happens to be. That if you get granted from us, it's not just a plaque on the wall anymore. It's any sort of social media that you can provide would be great. Section 10, it clarifies the simple grant. This is one of those things that I think got confusing over the years. There was an over $25,000, you were required to do this kind of stuff, but only if it was for a one-time purchase of equipment. And I was confused. And I think a lot of you were as well, because what I saw in these write-ups were, you just gave us all the information. If it was over 25,000, you didn't know whether it would be over for equipment, not for equipment, if it was this or that. You generally just tended us to give the information, and I appreciate that, because that's really what we were looking for at the end of the day. So now it's a cutoff. It's either under $25,000 and it's a simplified grant, it's over $25,000 and it's a regular general grant. All the language on equipment and stuff has been removed. And that allows, what the intention was, if you're not a big organization, you're asking for $10,000, really to make you go through all the added steps of what a general grant over $25,000 did. There's audited financials, there's board of directors, there's additional paperwork that we require of you. But if you just want $10,000 and you don't have this large administrative staff to be able to pull this together, it was a way for you to make it easier for you to get that money without having such administrative burden. When you report out in section 12, unique patients is better clarified. What I want to make sure that we are all on the same page with is, if you get a patient and you treat them and they come back in 2 months and you treat them again for essentially the same thing, that's not a unique patient. I'm not sure if that was happening or not, but I want to make sure that we identified what a unique patient is. Now, if that person goes through one part of your program and then goes through another part of the program, because you've got 5 programs listed on your application, then yes, you can consider that a unique patient in both programs, or a unique client in both programs. But we all need to be on the same page as to what a unique patient truly means, and that section is better clarified. Section 13, again, this is one thing that's been happening in the past as well. We'll get grantees coming back a year and a half later asking for the rest of their money. And I think in the past, we've probably paid that out in order to save the sanity of my CFO. We're not going to do that. Once the grant season ends, it ends, and that's it. If you didn't invoice us by the last date of the grant agreement, you will not be paid. And I'm sorry, we would love to have done that, and we're not going to track that. That's up for you to track. So if you want your money, invoice us, and we'll be happy to provide that money. But know that if you're past 30 days past the agreement deadline, you're not going to get the money. District, we limit funding to a baseline amount. What this is meant is, like I talked about, when they had 30,000 a year, 30,000 a year, 30,000 a year, and now you want 45 or 50,000. It's going to require a 4/5 vote from the board in order to do that. If the board says no, we're not going to do the 45,000, you'll need to go back to the grant application process and resubmit for whatever money you want. It's not to exclude you entirely from the grants program. So if you submit in July and they disapprove that amount, you can get back into line again and submit a new grant for the 30 that you had last year and have it reconsidered, or less, or whatever, and have it reconsidered. But that's the way the board wanted to process anybody who was asking for money that exceeded previous year's amounts. And finally, provide new. Section 15 just highlights that if you are a new organization, we saw a lot of new organizations last year that were providing great things. It required us to do some additional digging. How many are you going to do this year? How many patients? How many clients? How many are you going to do in subsequent years? What's the business model you have that supports that? What's your financial plan? What's your proof of concept? What are other organizations in the community that have done this before that you're modeling yourself after? All of these things we would want to know to say, yeah, great innovative idea. We just want to make sure that it's sustainable and we don't throw $30,000 at a project that was a great idea, but didn't necessarily have any backbone behind it. But surely just know that when you're going through the application process, that we'll likely call and ask for those additional pieces of documentation. All right, so for the simplified quarterly reports, some key things, as I try to see the screen. Timely submissions. If you haven't met Randy, you will. She's really good about making sure that after the first quarter is over with, we get the first quarter report back to us. Again, what we saw was we'd go through 2 or 3 quarters and then get 1, 2, 3 all in one shot. Once the first quarter is over with, she'll give you a certain grace period, and then we're going to expect to see those quarterly reports on a timely basis. Correct information. Some of the previous reports we've had wrong fiscal years. They had the wrong form altogether. There were forms from like 3 years ago that we were receiving. We created a new form you're going to see attached to this grants policy. It's not the 9 questions that were there beforehand. I know that was a lot of work because I saw a lot of cutting and pasting because you don't have time. It's the same thing in a lot of cases over and over again. All I want to know is, what are you doing and what impact does this have? Make it that simple. Again, I'm forwarding these to the committee members who don't have the time to read 9 pages worth of a quarterly report. Really a page or a page and a half. And it gets us an idea of, yep, our money's out there. It's being used wisely. It's having an impact on the community. I like what they're doing. Move on to the next quarterly report. The term of the grant agreement, make sure that that's included in there as well. Some of the big things that highlight for us are the goals and the objectives. So when you fill out your first quarter's report, put where your goals are for each of the quarters across the board. And that's the top section. First quarter, second quarter, third, fourth, and then total. This is what our intention is with that money over the next year. And a lot of it, you're going to give us the bottom line in your grant application because we're asking for it. But if you say, I'm going to do 100 clients this year, and that's the goal on the right, in the top right box, and you do 25 per quarter, and that's what your intention is, submit that in the first quarter, and then your first quarter results will be 27, or it'll be 18, or it'll be 50 if you knock it out of the park, and then gradually update that number as you go along. And it gives us an indication of how well you're doing. And if we see 0, 0, 0 with no justification, we'll probably call up and say, hey, what happened? How you guys doing? Is there anything you need from us in order to help get this program, get this grant off the ground? One-time purchase, one of the questions that came up this year is you bought us a bus or you bought us some cooking equipment. And do you really need a quarterly report every quarter? Because it really was just a one-time purchase. And the answer is no. Give us a report at the very end. Let us know how it all worked out. So we've got some indication of what that money went for and maybe how many clients you served. But I think if it seems redundant as a quarterly report because of a one-time event, then it probably is. Call us if you're uncertain and we'll let you know. And then again, the questions have been really pretty much simplified to make it easier on you guys to just let us know what you did. And if you want to, as in the past, if you want to send us photos, please send us photos. We'll put you out on the social media and publicize all the great work that you guys are doing out there. Invoicing, please, it's in the term of the agreement, send your invoices to billing@grossmonthealthcare.org. Really, I think this is standard stuff that you guys have been doing. There's usually an agreement on whether you're going to bill us monthly or quarterly or one-time annual. Let's work that out. I didn't want to be prescriptive to say, bill us on this certain time or bill us at each quarterly. You all have operations that you're working through. I don't want to necessarily dictate what that looks like. Just know that at the end, like I said, when the end happens, and we're not giving that money back. But invoice us based on what is best for your organization. And that's it. So I talked way longer than I thought I would, but I want to make sure that it's like I said, it's a new leadership. It's a new review of the grants policy. We've got at least one new director on the grants program that hasn't been on there for years. And so this just gave us an opportunity to take a step back, relook at what we were doing. Hopefully I know this helps the district. I hope it helps you as well. And from there, we'll be happy to take questions. And Amy will monitor the chat as well.
Yes, she got you already.
Should we go? Sure.
Okay, great. The first question I have is whether or not can we submit now for July consideration or starting July 1, or are July submissions to be considered in August? So where's that first round begin?
Great question. So we, because we didn't get the policy approved until this Friday, I haven't opened up the applications process yet, and I can't presume that the board is going to approve the policy before they do. So we're on a sort of a freeze mode. If you look at our website, it's all been updated with the right dates and all those kind of things, but you can't really do anything with it yet. The goal was that we complete this workshop. You guys know it's in a draft format, but it's up there for you to review, and that we'll publish this recording on the website as well. And once Friday hits and the board presumably approves the policy, then we'll open up the gates and you can start applying and catch that first July season. So you'll know that you've got the policy that will likely be approved. The only question will likely be in the scholarships aspect, which shouldn't affect you guys. But you can look at that now and plan for that 4th Wednesday due date and get it in. Then, yeah, so look on Friday and it should be available.
When you say 4th Wednesday, that means June for July, or the first ones will be at the end of July for August?
4th Wednesday in June for July. Yeah, no, July is a big month for us. We want to make sure we get it open.
Yeah, for grants asking more than 25,000, is there a cap?
No.
Can you repeat that question?
Oh, yeah. For those online, so for those over $25,000, is there a cap on how much? And my answer is no. I haven't seen a cap yet. I don't know if the board members in each of their mind has a cap as to what they think or not. But not as far as not listed in the policy.
When we apply for the July timeline, even though our current grant doesn't end in just.
Great questions. The question is, can we apply in July even if the current grant doesn't end until September? And we know this overlap. And again, our accounting department is like, oh, you guys are giving me a headache. Because we have to make sure that in our own mind, we track previous year's money with current year's request. And there's going to be an overlap, and we're going to pay you for this quarter. And you're going to invoice us for the new grant proposal. Yes, you can overlap that. Your timeline isn't fixed by previous grant awards from last year.
the point of clarification. Someone asked, the fourth Wednesday in June is not actually the last Wednesday, it's the 22nd. So would the 22nd be the date for submission for July consideration?
The fourth Wednesday is the 22nd.
It's next week.
Yeah, we'll post online, because this first one might be a little bit tricky. I think we run so close to the end of the month. And we need to have time to process all of yours, and so let me take a look at that. We'll post an update online with what we decide. What is the fourth Wednesday?
Of June.
Yeah, is it
22nd.
what's the next Wednesday? 29th
29th is the fifth and final Wednesday.
Let's go with that for now. I think in my own mind, the calendar math wasn't making sense to me for a moment.
Last Wednesday.
Right, we'll just say the last Wednesday and not the fourth Wednesday. It's a good idea.
Do you ever do like site visits before we're making a decision?
No.
For some grants?
No, I was for those of you who I see familiar faces, I was very specific this year, a lot of it being my new year, but I didn't think it was fair that we do anything site related until after a grant had been released. I don't want to give any sort of unfair bias as to us touring areas, or I need to keep it clean. Once the grant has been distributed, believe me, we're going to come out and visit you, because it's the funnest part of this process. I know for you, it's getting the money. For us, after we've granted, it's going and watching all the cool stuff that you guys do. That's the best part.
There's a few questions about the definitions of direct service and the geography. So can you clarify a couple of things? The requirement that equipment remain physically within the East County, within the district boundaries, equipment versus people, where the clients live.
Right.
As well as whether or not things like prevention, care coordination, referrals, transportation coordination, does that count as direct service?
I don't want to presume to not, or dissuade people, I guess, from not applying. I would say, if you think it fits within the direct care, submit the application, let us review it. I mean, you could have whoever is asking the question may have a great idea, a great program, or a great service. And I don't want to tell you no, because I don't understand enough about it now to let you know what the right answer to that really is. So I would say submit your application, let us review it. If we've got questions, we'll certainly let you know, and we'll go from there. From the location geography standpoint, I don't know that it matters as much as where the equipment lives, as much as where the services that are being provided are happening. So if you've got a van that you normally keep parking, downtown San Diego, but that van is going out to, feed the seniors out in the East San Diego, that's what I want to know. I don't want to know that our van is out not only serving East San Diego, but also North County and inside San Diego and all that kind of stuff. That van has to be dedicated to serving East San Diego County people, period.
Other in-person questions? Try to go back and forth. Equal time.
All right, nothing from in the room?
There's another question here regarding nutrition, food security, and hunger relief. Is there a specific priority area that you see that fitting into? The question is where in our pillars?
Yeah, I think food insecurity is probably impacts all of that. If you look at some of the Meals on Wheels and serving seniors, that certainly fits into our aging program. I think food insecurity could probably fit into a lot of those. I know we've got one from last year, and I apologize if they're on the line, Mama's Kitchen, who really does do good work at trying to put appropriate meal plans for certain chronic diseases. So yeah, you could probably fit food insecurity, nutrition, all those programs into one of the main buckets.
That's it on the chat side.
That's in the chat side. Here in the room? All right, well, I'm gonna close. We'll be here afterwards if you want to come up and ask us individual questions. But again, I want to thank you guys. The grant season is great fun for us because we know how much support it provides out in the community through you guys. You guys are the direct service delivery people that are impacting the community, and we're happy that we can provide the funding that allows you to continue to do that great work. And want to foot stomp again that, you know, once grant season is over with or whatever happens through grant season, that we want to continue to be here and expect to see us in a different venue, saying, hey, let's get together to talk about this, or let's get to talk about that. And we want to partner together in a different manner as well. So thanks, everybody. Appreciate it. And have a great day.
Take it quick,
Oh, I'm sorry. Yeah, Amy, absolutely.
Yeah, I just wanted to make an offer. Anybody who has never visited our library right across the way, I just want to invite you to come over and it'll take 5 or 10 minutes to go tour. It's a tremendous resource that is available to all of you who work here within the healthcare district, as well as to any of your clients who live or work anywhere within our boundaries. It's a public library devoted to health information. So I'd love to introduce you to our head librarian over there and let you have a look at it and ask questions. Masks are required, but masks for you. If you're interested, just come find me in the lobby here and we'll walk over.
All right. Thanks, Amy. And again, thanks, group. Appreciate it. And those online.
This was my grant meeting.
Oh,
It's actually pretty